Once there was this girl who absolutely loved ballet. She started dancing since the moment she could stand on her own 2 feet. The little ballerina had big dreams about being a star. She practiced every day. Some described her as having the grace of an angel. No matter where she went, she would never be seen without her purple tutu. The little ballerina was extremely talented for someone so young. At the age of 4, she was already years beyond her peers. Her ability didn't end with ballet. The little ballerina took her skills from ballet to the ice. She turned out to be just as grateful on skates as she was in ballet shoes. Her dream, unfortunately, came to a tragic end. This is Delilah. She suffers from osteogenic or osteosarcoma, which is a form of bone cancer. Teenagers are most commonly affected by this cancer, although young adults and children, such as Delilah, can also be susceptible to the disease. Osteosarcoma usually starts to develop in the bones around the knee or in the lower jaw. Dentists are now taught about the warning signs of osteosarcoma because an early diagnosis of osteosarcoma can usually be found at the dentist during routine dental x-ray checkups. While most bone tumors are benign, meaning they don't move, they still need a bone biopsy to determine if the tumor is malignant or not. Here are some warning signs you should look out for. Since a tumorous bone is not as strong as healthy bones, it might suddenly fracture. If the tumor is large, then swelling may occur. If you experience any of these symptoms, you may want to speak with a doctor. If the doctor thinks that there is a suspected tumor, the diagnosis process will begin. The diagnosis will start off with an X-ray and a combination of other scans and will end with a surgical biopsy. 90% of patients are able to have limb-saving procedures if performed properly, so they don't have to go through amputation. Unfortunately, Delilah here had to get her right leg amputated due to the cancer coming back after the surgery. Sometimes this happens. After surgeries, the cancer comes back again, so they have to amputate to prevent further spreading. Despite the success rates of these surgeries, it has a very low survival rate. 65% to 70% of patients treated 5 years ago will be alive today. Some causes for osteosarcoma is lack of chromosome 13, which inactivates the retinoplasma protein, which helps get rid of excess cell growth, which makes these kinds of people more vulnerable and at risk to these different kinds of cancers like these. Some new developments include the study of gene behavior and how they will react to certain kinds of treatments and radiation. Thanks for watching this video. Please don't forget to subscribe. All comments and likes are appreciated. Bye.